Some patients who have done a lot of research on breast implants ask us that how are the ways that you can do breast enhancement surgery? What are the techniques of doing breast implant surgery? So in this video, I'm going to break difficult techniques or steps of doing breast implant surgery and make it very simple for you to understand. I will also tell you what situations allow which technique of breast implant surgery to be done and who is a candidate for what type of surgery. So, breast implant surgery can be done in 4 or 5 different ways. The implant, this is a silicone breast implant, can be placed into the gland. So, we open the breast, above the muscle, we separate the gland and put the implant in between the muscle and the gland. Secondly, it can be placed subfacial. Subfacial means, so we open the breast, separate the gland along with a layer of fascia above the pectoralis muscle. That fascia is a strong fascia, it covers the breast implant and does not allow it to be felt. So it reduces the palpability. In fact, over a period of time, it even reduces contracture, the capsular contracture rates. This is the technique that is popularly done at Divine. Third, submuscular. Today, I don't recommend submuscular breast implant for everyone. I think it's an old technique and we don't like to do it at all. Fourth, dual plane. The best, the most modern technique of breast implant surgery is the dual plane technique. What is it? In the dual plane technique, as the word suggests, two planes, dual plane. First, we create a plane above the muscle. We move the breast tissue away from the muscle, create a plane according to what type of movement we want to create. So if we want to shift the breast inwards, we can do that. If you want to shift the breast upwards, we can do it. If you want to shift the breast outwards, we can do that as well. Depending on how much of breast movement we want, we start the first step of the procedure. In the second step, we lift off the muscle, put the implant below the muscle, and then cut the muscle here along the edges of the muscle, and that allows the muscle to rise up and cover the implant from the top, gives a great coverage to the breast implant and does not allow the implant to be palpable. The biggest advantages of dual plane surgery is that it helps the breast come inwards, upwards, gives a very high upper pole fullness, creates a cleavage type of an effect. The dual plane takes longer, is a little bit painful for 1 or 2 more days compared to the subfacial plane. So between subfacial and dual plane, how do you choose? If a patient is very thin with hardly any breast tissue, we do dual plane. If the patient wants the breast implants to come closer, then we do dual plane. If they want upper pole fullness, then we do the dual plane. If they want it for the media, where in certain types of clothing they want the breast to be visible, then we do the dual plane. If a patient has already got a good pair of breast and no sagging at all, then a subfacial is quite good enough. Dual plane also has the advantage that we can lift up the breast by about 1 to 2 centimeters. So mild cases of breast sagging can actually be treated with a dual plane technique. And I'm very sure you want to judge and you want to find out what is the best technique available for you. So you should connect with us, either consult me or you can do a video consult, and then we can assess which technique is the best for you so that you end up getting the best of results of breast enhancement.